Hello, welcome everybody. Thanks for joining in today. As the room populates, I'll just go through a little bit of Zoom housekeeping, who by all accounts we're probably all accustomed to, but we can't hear or see you, but you're welcome, and we encourage questions in the chat box in the Q&A. Just a little family office insights update. For the record, we were for the first time since March, we were able to have an in-person investor pitch gathering in New York City, and everything went smooth. And so you all can look forward to doing that again sometime soon. So I just wanted to give you all a heads up. Thank you all for being so attentive and attending our many Zoom calls through the COVID experience. And as you know, today's discussion is around how to mitigate and conform and protect people in workspaces and other spaces. And so it's germane to the whole COVID and pandemic subject matter. For the record, as I always indicate, whether I have an interest or not in the equity of the company, and in this case, I do. So just want a full disclosure, let everybody know that. I thank you all for being here today. Again, please feel welcome to ask your questions in the chat box in the Q&A. And also, this is going to be recorded. So if you care to look at it later in the Family Office Insights YouTube channel, or share it with others that might benefit from what you learned today. So with that, I'm going to hand it over to David and Mike. David, why don't you go ahead and take it? Thank you all for being here.
Thank you very much, Arthur. I hope you can all hear me.
Yep.
We're very happy to be here today presenting the work that we've done over the last 15 months for the first time, really open to an investment opportunity. We've been self-funded up to this point, and quite successfully so. So we've moved the company to a point where we thought we were worthy to be able to pitch it to qualified investors like yourselves. And thank you very much, Arthur, for making this forum available to us. And of course, a big thank you to the Family Office Insight Forum to allow people like us to reach people like you. So big thanks to Arthur for that. Just to give you a little bit of a background to who the main characters are in this play. We came together early on in the COVID epidemic from certain capacities. Each one of the six of us have, I would say, very different backgrounds, but we bring together a couple of centuries of solid experience in different genres, and combined into this very unique blend of medical and professional and commercial and operational. I'm David Greenstein. I'm the CEO of the company. I come from a legacy of an entrepreneurial early stage investors to running two large public corporations for 13 years, and then started my own family office, my own incubator in 2018, and was successfully joined by Mike and others to incubate this current company within our incubator. Mike Reed, who co-presents here with me today, comes from the biomedical field, is a PhD. He has had many years of experience in diagnostic devices. Mike and I met each other as we were tackling the COVID idea of work safety and COVID from two different angles. Mike was working at the time for RADx, which was the government, the diagnostic arm of Project Warp Speed. And I was trying to bring a test to market. So the two of us got together, formed TestZone, started to understand that the healthcare industry was catering at point of care, and nobody was really catering at point of entry or at point of work. And we came up with this idea that we'd become the world's first health security company. Angus Thompson is another PhD, has a long relationship with Mike. He lives in Lyon in France. He's a public medicine and communications specialist, worked for Sanofi Pasteur for many years in vaccine education and for UNICEF. David Orolovitz joined us as a late founder in January of this year. After 22 years of being one of the chief architects at Goldman Sachs in the IT department as our CTO. Elliot Cowan, another PhD, who ran the diagnostics division of the FDA for 17 years and joined our ranks very early on. And Rob Feichel, who is one very operational fellow who came out of Toyota Nagoya originally and has worked with General Electric, Honeywell, some of the large companies, a specialist in lean operations, and is standing by to help us scale our company as we get adoption. So these are the 6 founders. We are undiluted at this present time, and the 6 of us together own all the stock in the company. So let me just talk just a little bit about what this investment opportunity is. As I said to you previously, we are, I believe, up to the time of this presentation, the first dedicated health security company in the world. That's a big statement to make, but we haven't been able to prove that wrong yet. We're waiting to see who's going to jump in to this genre. But at the moment, we feel like we at least got a huge lead. Obviously, this is a monsterly large, massive addressable market, especially when it comes to the GSA, commercial real estate that's out there, and of course, regulation, which we're starting to see come into play. I mentioned before that we have this very experienced management team. We're not traditional startup people. We've been around the block a lot, and we've worked together very well for the last 15 months. Our business started with some large Netflix contracts. So we already generated almost $3 million of revenue this year. In the first 6 months, we're already $600,000 positive EBITDA, which has been funding our operations up to now. We are, for all intents and purposes, a technology platform, creating a hub technology and data set that could be used to protect people in spaces and then later used for analytics and research.
David,
as I said
I just want to make sure it wasn't clear when you said it, but it was a Netflix contract.
Correct.
It just didn't come through clear. I just wanted to make sure.
Sorry, a Netflix contract. That is correct. And as I said to you before, we're an undiluted founder base still. This is our first attempt at raising funds. I show this slide because it really shows the needs, the genesis of the need. These 4 pictures represent an interesting story. On the extreme left, in what we call unregulated unpreparedness, is the Potter Palmer building called Palmer House that was built in 1871 in Chicago. It was most probably one of the most beautiful buildings in the United States of America at the time. 13 days later, it was reduced to rubble in the Great Fire of Chicago. Mr. Palmer himself was one of the first people to think about fire code in this country. And 3 years later, he opened up the new Palmer House using the first fireproof building materials and adhesions to what were the embryo of fire code in 1873. And that building stands today as Palmer House Hilton in downtown Chicago as the longest continuously operating hotel in the United States of America. The story here is that genres of unregulated go through catastrophe, become regulated, and then become resilient through that preparedness that regulation and subsequent security brings. So to draw directly from that analogy, as the Great Fire of Chicago brought about 13,000 pieces of fire safety code, both federal, local, and state, as well as opinions of OSHA, there's a $68 billion fire security industry out there right now, growing. As 9/11 brought incredible response from Homeland Security and the TSA, there's now a $128 billion industry around terror, anti-terror security, physical security. And we believe that this analogy is correct for COVID as well. In fact, could be even more correct for COVID. Not necessarily that COVID, the event, has shown us the vulnerability that we all have, By all intents and purposes, last week we saw an article that it's caused already $16 trillion of economic impact, negative economic impact in the United States. And now we're getting into the area, just as fire code and as Homeland Security brought regulation into those genres, we're starting to see some regulation, some mandated regulation and some suggested regulation starting to come into the idea of health security or securing workplaces, highlighted by the Screen Actors Guild, who were very early on. It's basically where we got our start. It was based on a protocol from SAG. Just earlier this week, obviously everybody knows about the New York HEROES Act. The White House opined yesterday. OSHA is going to start to become more forceful. There's already a GSA safety workplace strategy book. And so what was complete, unregulated, uncharted area of health security is looking for leadership. And we believe we are the first at the trough to supply this leadership as regulation and need accelerates. Just this week. So these three columns represent just this week. It was kind of like everything we've been working for and talking about for the last 14 months. The vortex came close to us. We're just about to get accelerated into an almost unprecedented demand for at-work safety procedures, protocols, and ways to cope. On September the 3rd, the American Pandemic Preparedness came out from the White House with a $65 billion plan to establish offices for pandemic preparedness. 40% of which is going to be used to fund diagnostics and better public health and warning systems, which is what we are. On September the 6th, the new governor of New York declared that COVID is a highly contagious disease and put it squarely into the crosshairs of the New York HERO Act. And for those that don't know what the New York HERO Act is, it is a significant health security measure on both employees and employers and landlords for employee screening, preparedness, protocols, workplace hygiene stations, quarantine protocols, building airflow technology, among others. This is now law in New York State. The scramble is on to be able to adhere to this law and comply to it. And then, of course, anybody who was tuned in yesterday afternoon saw our president talking about now mandated vaccination for government workers, and a combination of vaccination and testing for all private companies that have at least 100 workers or more, 100 employees or more. And this, of course, is creating some consternation among HR departments who don't quite know how to comply with this. And it's become a real big pain point for them. So obviously the need is great, and the need has become greater in the last week even, with this new regulation and these new mandates coming out. The need is split into two parts. It's split into the real estate part, where you see this massive problem in real estate with unoccupancy turning to vacancy. So we see now the 12.6% estimated reduction of office real estate values. And this is becoming a real pain point. We're already seeing newspaper articles about landlords that are being called, their loans are being called because the underlying structures of the valuations on which their mortgages are based are starting to come into question as people aren't returning to offices, and that return to office might be in a completely different form to what these landlords prepared for, and the banks are starting to realize that. And of course, tenants are bugging the landlords to say, we want to come back to the office, but now there's either regulated or unregulated needs. So we see 90% of investors reporting that tenants are demanding that health and safety be a priority of the landlord itself. Of course, there's the tenant side, with the 60% of workers, number one, concerned about return to work is risk of infection, and 67% of employees consider enhanced health and safety protocols a top priority to return to offices in person. And this is under the current situation. It could get worse, it could get better. Better means that we go into a peacetime where it's just protecting against flu, which takes out about 11% of the US workforce every year. Or worse could become this prediction by Dr. Tom Frieden that the next pandemic could be even costlier and deadlier than this one, and we better be prepared for it. We better have learned from this one. Does 18 months of working from home teach us something? And how should we react to that? So definitely strong statistics showing that the need is great for what we do. This is most probably the most scary pie chart you'll see. There we estimate there's around about 11 to 12 billion square foot of commercial real estate. This is outside of education and government or healthcare. At the moment, from our latest figures, about 7.4 billion of the 12 billion is empty. Either empty because it's leased and unoccupied, or empty because it's just plain vacant. And obviously, the longer the leases are unoccupied, the less chances are that the leases will renew. And the higher chance is that vacancy, this 1.7 billion square feet of vacancy is going to grow. And so landlords should be looking for solutions to try and stop the disintegration of their tenancy. So I set it up because I wanted to just show you that the need is great, and that people who aren't thinking about the safe return to work, whether you're an employer who needs to have that solid age-old tradition of people working together to create better product, better services, or whether you're a landlord, you're getting calls from your banks, everybody, the market is absolutely massive. And the need for a total solution is very, very great. I'm going to hand it over to Mike Reed, who's our Chief Science Officer, to explain to you what is the philosophy behind how we do things, what we learned in the last 15 months, and why we think we're in a very special place to invent and pioneer this particular genre of health security. So Mike, to take people through the next couple of slides and show how we do it.
Great, thanks so much, David. And thanks everyone for joining. So as David said, there's two pieces to this puzzle. There's the building owner who's suffering from vacancy and lack of occupancy. And then there's the employers who are trying to get their people back into the office and haven't been able to, as it hasn't been safe enough. And so the value proposition is quite different for both, even though in the end the goal is the same. From the customer side, the department that is really being impacted by this, and even more so now that vaccination and testing and other protocols are being mandated, it's been falling on the shoulders of the human resources departments. And so our HR professional community is now becoming a health security community and adding that to their job description. And so they're figuring out the protocols, they're figuring out how to monitor health screening, they're figuring out testing and then contact tracing. They're answering questions all the time, every day, about quarantining and exposures and test results and so on. And it's a huge burden. And I'm actually right now in Las Vegas at the annual meeting of SHRM, which is the Society for Human Resource Management. And just this message is coming through loud and clear from vendors and from HR professionals that this return to work and this health security job is falling square on the shoulders of HR, and they need help. And there's a lot of other benefits to what we're doing as well. And we see this as being a much greater need and a much longer tail than just getting people back to work and surviving in COVID. That the mindset is going to be changing, and regulations will come in place that will require some level of preparedness and health security on top of what is there today. And then on the landlord side, I think the need, as David said, the need is really great. They have to have people in their buildings. Their loans and the valuation of their properties is tied very intimately to the cash flow that's coming through their building, and that cash flow comes from tenants. And so when they don't have people in the building, they lose value in their asset, and increasing the health security of their building and adding these amenities actually not only will get people back, but they will be able to increase their lease premiums and keep tenants in their buildings. And so we're thinking about it like this, because to landlords, there was this sort of the initial conversations we were having, it was sort of coming across as this is something new that the landlords need to now add on to everything else, and they weren't quite sure that they really needed to do this. And I think as we've talked more and more and understood this space, what's happening now is it's one more step in the evolution of building technology and building requirements. And so it started back in the 70s with the green building movement, which was all about energy conservation and efficiency. And it sort of moved into healthy buildings in the, I guess, early 2010s, where not only sort of reducing cost of running the building, but also thinking about the indoor air quality and indoor environment of these buildings and how that was contributing to the health, productivity, and well-being of the tenants of that building. So there's this big healthy building movement now, and it's described very well in a book published last year by a very well-renowned public health specialist in this space, Joe Allen. His book's called Healthy Buildings. It's a very interesting read. But this Healthy Buildings initiative, and it will become a mega market in the coming years. But it's still just dealing with buildings. It's still just mostly the landlord that has to put infrastructure in place and equipment in place and so on to get their building up to this standard. And so now we're in this space where Healthy Buildings is now moving to health secure buildings. And so this is this health security market, health security industry, where there's a much greater onus on the tenant and the employer to enact protocols that keep their people safe. So you've got playbooks, you've got health screening, and then managing outbreaks, having pandemic preparedness plans, and so on. And the tenant needs help from the landlord because there's infrastructure that they need in the building, which is really an extension of the healthy building technology. So there's this evolution from sustainability to wellness to now health over time. And so this is over maybe a 40-year, 50-year period. And then the contribution has changed, and the onus has moved from landlords and building developers to a pretty equal, probably in the end, partnership, biased a little maybe towards landlord, but much greater contribution from the tenant to keeping a building and their workplace health secure. So this has then now led to, well, what does it mean for a health secure building for an employer? It sounds complicated, and there's many things that can and should be done to keep a workplace safe. And what we really like to stress when we're talking to prospective clients is that there's a huge suite of solutions that we're providing, and it's turnkey, and it seems complex, but for the employer and the employee, it's really just another day at the office. So entering your symptoms in the TestZone app, and it's a health screening app, so it's got vaccination and test records and so on, but that's basically your key to the building. So you enter your symptoms in the morning, you put on what we call a zone view lanyard, and I'll talk to that in a minute, but that's basically a Bluetooth monitoring system once you get in the building to enable contact tracing and occupancy management and smart, intelligent cleaning based on where people are spending their time. The smart lobby is really key to the sort of health security of the building. This is where we set up turnstiles, and where the health pass activates those turnstiles. And basically, it means that anyone who enters this building and goes through that turnstile has been screened to a level of health security that that is agreed to by all the employers and none. And so you have comfort inside the building that anyone you interact with is in the same health shape that you are. And so then you go to work, and then it's all about working safely. And so it's the protocols, it's the air monitoring, it's just this constant, which should become subconscious, sort of thinking about your health and the health of others, and from being sensitive to symptoms and how close you are to someone to the way you manage your environment, your facility. So it's really, there's no real change with this platform to the way people are coming to work today. And so if we dig a little deeper, so what's underneath that that service? And we have 3 layers of solution. So this first one, this purple level, which is our platform, we develop it, we own it. It's the front end to the user is the app, and then there's analytics at the back end. Really importantly, really exciting to HR professionals that we're speaking with, is that we put a health safety supervisor on location who is a healthcare professional, not a doctor, not treating, but who will take the phone calls from people asking about quarantining and contact tracing, will take ownership of the testing and the health pass management and all of the compliance, and partner with the HR team, but take the burden of their of the health security from them. The rest of the platform is really just about analytics and keep monitoring the health risks in the building, so that people know where to focus their attention to the building to keep it health secure. On the people side, so this is basically tenant responsibilities. So we've got the Playbook, which is basically the guide to everything that is going on in that building and in that employer space, from federal regulations, from the CDC, OSHA, all the way down to room by room occupancy limits and everything in between. And so we have a template playbook that we then customize with the employer. Communications, really important. So guiding people towards the healthy, safe behaviors, helping employers communicate clearly about what's happening and why things are being done, so it takes the confusion away. This is a really great source of stress and confusion that's being created in workplaces. And then, of course, already talked about the health screening programs and people movement with the Zone View Bluetooth tracking system for contact tracing. And then on the building side, so this is more this is where we work with the landlord, and we set up the smart lobby, which I've talked about. We also have passive. These are more kind of passive things that the employer doesn't see, but know that they're there. And so we've got air and surface treatments, so different technologies, whether they're coatings or disinfection equipment and so on, that is creating a cleaner environment, both from microbes and viruses to volatile organic chemicals, which are airborne chemicals you need to keep low. And we've got these treatments to make the air safe, but that treatment and what treatment options are put in place is really dictated by understanding what's going on in the space. And so we're monitoring the indoor air quality for chemicals. We're monitoring surfaces to see where there's potential spaces of areas of concern and contamination. And so we partner, and then of course the intelligent cleaning solution with Zone View. Really, at the end of the day, we can see which rooms have had the most traffic, and partner with our cleaning service to make sure that they get special cleaning. You can also monitor the that the cleaning crews are actually doing their jobs. So these things all come together. These are all through partnerships and allow us to make sure that the most current, the state-of-the-art technologies are brought into the environment and allows us to quickly change as technologies evolve. And with that, I'll hand off to David.
So thanks, Mike, for that in-depth explanation of what we do and how we do it. I just want to compliment Mike and the team for having put together this strategy. It came out of our experience. This people place strategy came out of experience with Netflix, where we realized that in order to do a good job here, it wasn't just about the space, it was about the people coming into the space. Everybody is a virtual unwitting bioterrorist, so you need to take the human element and the physical elements together. And that last mile needs monitoring, and monitoring needs to be regional. So when we came up with our business model, we decided to take two paths simultaneously. One would be a more determinative path, where we call it our Lighthouse Strategy, where we'd find buildings in different regions of the United States of America, take small space in those buildings to create our regional operation centers and our regional NOC centers. A NOC center is a place where our health security supervisors and site managers can actually monitor the buildings in that region live, looking at symptoms, looking at air quality, and reporting anomalies to the stakeholders. And so we split the country into 8, and we started to look for places where we could get landlords to allow us to wire buildings, take out our small tenancy, but convert the entire building at the same time. And we've been very successful with that strategy, and it's starting to roll out. So that would be our planned growth. By the way, our entire business model for the next year and a half is based just on that. All the Rainmaker stuff, which you see on the right-hand side of your screens, is opportunistic stuff that might or might not happen. We think now, after this latest round of legislation and mandates that came over our bow in the last couple of weeks, it's more likely to happen, but all the numbers and figures you're going to see in this presentation are not taking that into consideration. That would need express growth, that would need maybe a different round of funding, but it's happening simultaneously. I just want you to know. So lighthouses are our determined strategy, and Rainmaker is our opportunistic strategy. If you look at the Lighthouse Strategy for a second, basically split the country into 8 segments, take a 4,000 square foot to 5,000 square foot space in a great Class A building, convince that landlord that we're the right things for them so that they allow us to come in and wire the building, and then mandate that all the occupants of that building would be under TestZone, so we pick up our first subscriptions. Just to mention, the big change in our business model came about 6 months ago when we went from the movie business, where we were doing all of this work for a 14-week movie shoot, to doing the same amount of work and getting a 5 to 10 year subscription model going with a tenant and a landlord. So obviously you can understand why this pivot is so important to us. I can report that we're making solid progress here. We found areas in the country where there's high vacancy, mostly because areas where there was a lot of delivery of buildings into COVID. Fulton Market in Chicago, where you see that green, we already have proposals back from buildings that are accepting our technology, and there's actually a little bit of a competition going on between a couple of buildings with some big names attached to them. So we feel very confident that we will be up and running in our first NOC center and our first regional building within the next 6 to 8 weeks. The leases are going to get signed and the building wiring will begin. We're seeing in the second line of defense, Austin, Texas, the domain region of Austin, Texas, and most probably Washington, D.C. or New York for the Northeast. We're very advanced already looking at Rhino, which is River North in Denver, where there's a big problem brewing. And most probably from there onwards, we will progress onto the West Coast. The new mission in San Francisco is a great example, 43% vacancy right now, with a lot of Class A buildings that just came into being. Most probably Charlotte for the Mid-Atlantic region, somewhere in later on next year into the Florida region, and somewhere in the Pacific Northwest, either Portland or Seattle. Those are kind of the second tier of our campaign. So we're targeting 8 lighthouses, and the tenants of those 8 lighthouses, those would give us about 1 million square feet, and they would bring along with them organically between now and the end of next year another 12 buildings in those regions, with the lag that's predestined for that. So by the end of next year, we'll be securing almost 2 million square feet on our way to our eventual business plan. And now this can change radically if we get into the Rainmaker model. So simultaneously to us working with landlords and leasing agents and now some tenants in these prospective lighthouse buildings, this work is coming to us rather than us pushing. This is our pool. This is enterprise employees. Somebody just came to us and said to us, we have a problem in HR department. We employ 1,000 people. We need you to come in and set it up. We'll talk to our landlord. HR consulting firms like Deloitte and others who are getting calls daily now from HR departments. What should we do? Global real estate brokerages. We've accelerated discussions from local leasing agents to C-suites in all the majors, JLL, CBRE, Cushman Wakefield, and Newmark, where we're now having discussions about them adopting us on a more national platform where we've been very regional up to this point. We're in advanced discussions with providers to government to be a subcontractor for some GSA buildings. We're taking our film experience to standing studios in discussions with people like Hackman and others. There's also a big discussion going on with bio buildings where people can't zoom in. You have to work in labs. So in companies like Alexandra Properties, that the largest real estate company in the country focused on lab buildings, and live discussions that begin next week with Trammell Crow. So you can see there's people, and now also building management. So those arms of Newmark, SL Green, and others that are actually doing facilities in buildings are very interested in now adding the facility of health security, but don't quite know how to do it. So we wait.
David, yes. I'm sorry. If you don't mind, and you can not answer this now because you might be getting to it, but I think this might be a good time for, in the absence of TestZone, for example, how are these things being addressed now, if at all? And then TestZone now being available, contrast how the ad hoc or one-off solutions have been, bumbling about, and what really was happening, and how these HR departments or others have been solving this problem and pretty much haven't. I think it would be interesting for everybody to know that, how people are doing this now in the absence of TestZone.
So I think we'll get to that on the competitive grid, I think.
Fair enough.
Where we can see it, David, unless you want to add something.
No, I just wanted to say to Arthur that that's a good question, and we do get to it in this presentation. But one overlying or umbrella fact that I can tell you is that the only people that really started to tackle these were the essential services, these very early on people that had to go to work, manufacturing, warehousing, Amazon, and others. And our market is this commercial real estate market, where it's been kind of a lazy, like we'll stay zooming from home because it's going to be over. I don't want to remind everybody here that just 8 short weeks ago, the CEO of Morgan Stanley said, we're all back to work on the 1st of September or else. And so we're seeing the prevailing mentality is changing to this is no longer a one and done thing. And so now the people who are less capable because they weren't forced into it because it was essential are now struggling. And so So the people who found single solutions to somehow cope with it, those people and everybody else now has to mechanize it into something that's sustainable and that can run in the background, and that's where we come in.
Perfect. Perfect.
I hope that answers the question, Arthur.
Yep, that's what I was looking for.
So this is just a quick timeline on a Q3, Q4, and the Q1 to 4 next year as we bring buildings online. On the left-hand side here is our revenue stream. Like, I know that it's hard for people on this call to imagine that we're going to be doing $750 million with $110 million of EBITDA just from our organic growth without anything marvelous happening over a couple of years between now and 5 years' time. But we think it's highly realistic that a company that leads, like TestZone does, into this genre will have 700 buildings, be securing 150 million square feet, be securing 750,000 employees in 5 years' time. And that generates $100 million on our modeling, even with a 50% dilution of revenue coming over time as we scale on our subscription fees. By the way, just so that you know what we're asking for here, we're asking a landlord to contribute towards this at $1, reducing to $0.50 a square foot a year. And we're asking the tenants to give us $20, reducing to $10 per person per month on the subscription. And that's the economic model that we're forecasting on this slide. Actually, this is the competitive slide that Mike was referring to. So I'll let Mike take it over and describe to you where we are and how we differentiate ourselves as a multiplex against all the people giving single solutions.
Thanks, David. And so, so here on the Y vertical axis, you see the representation of physical this migration from sort of physical security to wellness to health security. So thinking about the market in terms of, there are providers who provide physical security only, so security systems and the quality of the building. It moves into wellness, and so this is sort of the healthy building space, and then into health security, where we're thinking about people's health inside, and so it's really addressing the health needs of directly of people. And on the x-axis, from left to right, single solution providers moving to solutions platforms, and so providers who are addressing multiple elements of the needs for a full health security program. And so we've got ourselves up in the top right, and this is why we say that we're unique right now. And there are no other businesses, and we've spoken with many of the companies on this grid and actually partner with quite a few, and including Johnson Controls. We've spoken with Johnson Controls as well. And so these companies who are in the healthy building space, if we just focus on that, companies that are in the healthy building space, they haven't addressed the people side of this yet. So they haven't addressed the need for health screening. They haven't addressed the need for playbooks and managing people throughout their facilities. And so there are the way that people address this, the way that HR departments address this is they go to the CDC website and they see what's recommended there, or they go to OSHA, or they go to their association, or they hire a consultant to write their playbook. And then they have to decide what measures they're going to take to, one, improve the facility that they're in. So air quality is really the key thing that needs to be monitored and managed. And there's many, many different ways to skin that cat. Then you've got the health screening side of things, which then moves into outbreak management, contact tracing, quarantining, testing, and so on. And so they go to companies for the health screening management, like Clear, which most people will be familiar with it at airports. So starting with airport security, but now they've moved into this health screening space. GoEvo is another example. And then you've got more consultative type companies. So the public health company, where they put protocols together and make recommendations. They've got labs, and so they'll do testing. They handle pieces of it, but it's really just handing it off to the HR professional to then run with it and figure it out. And so we take all of this and then add a little more. And so we're adding staffing, we're adding the health safety supervisor, we're writing the protocols, but we're actually managing the protocols and managing compliance to the protocols. We're providing the app and the IT platform around it. So it's fully comprehensive solution that covers everything in the top half of this grid, basically. And so it creates a very simple solution for our clients.
So just to give you the timeline, thanks, Mike. To give you the timeline, so we were formed back in the middle of 2020 with a small Wonder Brand self-funded investment from the incubator. Of course, that we got lucky or got this great opportunity with Netflix, which gave us revenue, and the revenues it was profitable and got us through to this point. We're now in September, where we're starting to think about some safe $3 million of safe, which I'll describe to you in a second. And then we start to generate revenue at the beginning of 2022 that takes us forward. This all just takes into consideration our cash needs under the Lighthouse Strategy. This current funding round will see us through the 8 lighthouses, the building of our team for those lighthouses, and our operations for the next 16 months till the end of next year. We started the funding round a couple of weeks ago. It has been quite successful up to this point. We decided to use a safe because it was an easy document for us to do, and instead of spending a lot of time with lawyers, we just thought we'd use a common document. I'm not sure if anybody on this call does safes or like safes, but for where we are at this stage of our fundraising, it's a nice, easy, understood, and universal document that everybody understands. Basically, what we're offering here is a simple agreement for a future equity at a discount. Basically, the amount we're trying to raise is $3 million. We're about 15 to 20% there right now, just on kind of friends and family calls. And now we're starting, and we're in deep discussions with people who write the bigger checks where they needed more diligence. And so even though this safe expires on October the 31st, our feeling at the moment, without being too cocky, is that most probably we will be subscribed by the end of this month. That's how fruitful some of these discussions are becoming. So if anybody's thinking of writing a check to us, it's as simple as getting a download of a data room that Mike will be setting up very shortly and giving you access to, seeing the actual safe itself, telling us that you guys want to sign on to the safe, describing how much you want to sign on for. You sign, we sign, you transfer money to us, and you're protected in the safe round. Currently, the cap that we're offering to the advantage of the investor is 20 million. So even if the future equity round is 100 million, it'll be capped at 20. And currently, we're looking for a minimum investment of $25,000 that will enjoy a 20% discount on the first future equity round. And this money will be used for the Lighthouse Strategy implementation and the continued development of our IT platform. This might all happen quickly. As I said to you before, we think in the next 2 to 6 weeks we'll be done and at least ensure our future. And then, of course, if something explodes for us on the Rainmaker strategy, we'll be out there with a seed round, most probably, or a more sophisticated round, but we will have some contracts in hand that will need that accelerated dollars for accelerated growth. So this might turn into equity relatively quickly. We're more robust about another round before the end of the year or early next year. Now, after all these announcements in the last 2 weeks and more to come, than we were perhaps when we were preparing this document a few weeks ago. So that's it for us. We're here, Mike and I, we've still got, I think, 10 minutes. Arthur, I don't know if you've collected any questions. And we'd be happy to answer anything that came across the bow while we were talking.
Yep, there's questions. Our friend David has asked, what value do you see in the actual data collected?
So okay, Mike, do you want to take the data side because it's sensitive?
Sure. Yeah. So I think the data value is a much longer play, and it really depends on quantity and number of subscribers. But early on, the data is used to identify risk areas and potential outbreaks that are occurring at a site or in a local region. So for instance, models, already there are models which will flag high risk locations in building, high risk rooms in buildings. And then as you start correlating that with symptom reporting and test resulting, you can start really getting an understanding of the what's going on in that building or in your employee group, and take action to remediate. Longer term, as more and more subscribers join, but we also, in addition to subscribers and the data from the buildings, we have a long roadmap of data sources that we will be aggregating and analyzing, basically developing insight from. And so these come from a mix of public sources, so looking at outbreaks and local environmental conditions, looking at different diseases, not just COVID. So we're talking flu, we're talking many different outbreaks. Legionnaire's disease is making a bit of a comeback now. I think with buildings sitting empty, there's been a lot of water quality issues as people come back. But basically monitoring and with all of this very intimately personal data, with symptom reporting that's anonymized, but symptom reporting and test results and air quality, then starting to layer in macro data and public data sets, it becomes a really immensely valuable public health data set for epidemic, pandemic, outbreak surveillance, and other conditions. So we start thinking about mental health and mental health determinants, and on and on. The list becomes quite large as you think about the data streams that can be coming in. There's also a lot of, I guess, just on that end, as you get more and more sophisticated. So there are machine learning, AI sort of platforms out there right now which can detect the onset of clinical depression in a person based on the way that they interact with their phone. So it's called the exhaust from the way people type on their keyboard, and it doesn't have to be a smartphone with a touch screen. It can be just keys, but there's data that gets collected through the phone and the way that you interact with that keyboard. There's algorithms out there which can predict that someone is entering a clinically depressive stage. So there's a lot of really incredible science out there related to public health and sort of health data that we'll start layering in here. But again, that's a very long-term view. Short term, it's really very tactical about just monitoring your building and taking immediate action to reduce risk.
And to that point, we don't have any signed income revenue from our data collection as raw data, for a couple of reasons. First of all, we want to be very conservative in how we could build that into a revenue stream in the future, and not represented in our numbers right now. And second of all, because every person who downloads our app enters into a doctor's office. Basically, we're HIPAA compliant. We take a lot of pride in being completely walled off from the employer and the building management, and we act as a medical provider in that respect. This we learned at the movie business. So when you download our app, you actually sign the consents, all the mutual consents for sharing your personal information, and we have to, under government federal law, respect all that personal information. The stuff that Michael was talking about a minute ago was more like the aggregate data collection sets from anonymized data that could be really interesting later on for research. That might be an interesting revenue stream for us, but we're not in the business of sharing people's personal data for gain at any stage of our development.
Yeah. So another question from David, and he stole my line. Said, "Can you determine now that I'm depressed?" Based on how he typed the question. And David, for the record, I'm an expert at this. You're doing fine. So he says, more critically, how does TestZone get OSHA or GSA to adopt their platform specifically? I think that's the question.
So here, part of our business plan was we'll build a platform because we know what it takes to put the pieces together to create a platform. And unfortunately, there's very little leadership out there in health security. We are a one of one in many respects. So if we take a leadership role, and if we start to be adopted, we think we'll be able to get a seat at the table with certain of these institutions that will be opining about what safe return to work looks like, what the new normal becomes, what safe workplace looks like, and what health security looks like as a new genre. So our scramble actually to get in front of this, at least as thought leaders, I think will have great effect. Mike and I have determined that most probably Washington, D.C., because of its proximity to the government think tank, is going to be a really good place for us to eventually be headquartered, because we do want to have a seat at the table, and we do want to start writing our solutions into the legislation and the recommendations, mandates that come out in the future. But at the moment, it's a little bit of an open shooting match with people grabbing at things. And hopefully our system will become an inspiration for the lawmakers to say, okay, something now exists, let's mandate it.
Totally makes sense. So to our guests, on behalf of TestZone, there is clearly an ask here for the investment. And I would, if I can take a liberty, David and Mike, to just say, as you're thinking about this as an investor, you're most welcome to think about this in terms of a potential customer as well. I'm sure that wouldn't hurt. And then feel free to share what you learned today with others that would benefit from knowing about TestZone. And we'll be staying really close from a Family Office Insights and Bevelis Group, my holding company, to what TestZone's doing, and keep you all posted on that. So we'll make sure that everybody that had registered for this call and attended gets in touch directly with David and Mike. And then there will be, if you're interested, a link to the data room, and you can determine whether you want to vote with your checkbook here, and which would be most welcome. So you want a closing statement, David?
No, thank you very much, Arthur, for setting this up. And thank you also for your participation in our round. It means a lot to us. We do think this is a golden opportunity. I hate to use the word unicorn because I think it's a bit. I've had a career of 40 years in business, and I've never been faced with this much just groundbreaking new opportunity. There is a massive land grab out there. It's going to become a very institutionalized part of our lives, and we believe we're at the forefront of it. And so it's a great opportunity. The people that are on this call, I think, have the privilege of being invited early on to a story that I think, with this type of team and with the help of our investors, will become one that will be studied for years to come.
Super excited to be part of it. Really love you guys. We have already
Thank you.
said that out loud. So thanks again, and thank you everybody for being here. And we'll make sure everybody keeps in touch. Thanks, Mike.
Thanks, Arthur. And
Thank
thanks
you,
everyone.
Arthur. Thanks, everybody. Bye.